Hi, I'm Dr Colin Smith. I'm the Regional Medical Coordinator for Tasmania. I think my role has quite a few aspects to it. It involves recruitment, retention, support for staff, support for doctors, support for people who are involved in recruitment and retention, making sure that people who are working in our sites are happy, that doctors are in the right roles, fulfilling their roles, and keeping doctors and the business safe on a day-to-day basis. So a big part of my role is, I think, is training and helping registrars get training posts. So there are possibilities for fly-in, fly-out roles to some of the remoter communities. As part of that, I think it's really important that we get new doctors on board. I think it's important that we get new enthusiastic doctors on board who want to be part of communities and who want to help other doctors then get on board. So that's, if I was passionate about anything, it would be making sure that we've got doctors coming into communities and coming into roles that will suit them. GPs and registrars coming to Tasmania have a range of opportunities to pursue their special interests because of the number of practices and different type of practices that OCA have here. I would definitely recommend OCA. There's a very wide breadth of opportunity in OCA, from people who want to work as a straight GP to people who want to work in isolated remote environments and be working on their own. One of the reasons I came to Australia initially was because I didn't want to work in the English general practice system, and coming over to Australia gave me the opportunity to work in places that didn't have the full suite of medical services. And in the last few years I've realised that by working with OCA. I think any doctor can find their niche in OCA. OCA's aim is to provide the best healthcare outcomes possible, providing autonomy, independence for the doctors, and a supportive framework for them to practice in. You can expect support at all levels of the organisation. That's in transitioning to a job in a new place, settling into a job, support from practices and practice managers and other doctors in the network, up to clinical support if you had problems, and including support for your family, moving to a new place, and support in a governance role where we would be helping people out if they come across problems. I'd also like to think that if we can provide a positive experience for everybody who comes along.